And without further ado, I'll kick things over by welcoming my colleague, Melissa Williams, who is our Associate Director of Policy and Advocacy. Melissa, go ahead.
Thank you, Nicole. Hello, everyone, and welcome to our final day. I have to say this was of the days that we had planned for Patient Congress. This is the one that I was most looking forward to because we get to see everyone's faces. This is the next best thing. I'm going right, on the top of my Zoom screen right now, looking at everyone, and it's really great to see you all. And, it's the next best thing to being in person. And so we appreciate you all sharing your screen with us. But I just wanted to just say a few words about these past couple of days, because, it has just been incredibly rewarding to put this together and to share it with all of you. With everything that's been happening with the pandemic, having to move Patient Congress to be virtual, we really saw that there was an opportunity here to reach more people. And I've been getting many emails from you all just saying just how wonderful it is to participate in Patient Congress, that you didn't have a chance to previously, and you're really enjoying all of the information. And it's just been great to get those notes because we've put in a lot of time to make sure that we can get this out to you seamlessly. So I just wanted to give that note to you all and say thank you for joining us all 3 days. And we're excited to get started. I'm not going to say any more because I am just also excited about the presentation that Rebecca Ango, Rebecca Kirch, and Gwen Darian will be giving here shortly. So Rebecca A., I'll turn it over to you.
Hello, everybody. I echo the sentiments about being able to see everybody's faces. I really do. I'm an engagement person. I'm a community participatory researcher. So seeing faces is much better than staring at my own slides. So this is great. So I just wanted to make sure that you guys have my slides, or do I need to share them?
You'll need to share them, Rebecca.
Okay, okay. So I had help yesterday. All right, so I'm going to share my screen, and I just wanted everybody to know if you're not seeing my screen once I do share it, what you can do. Here, let me just share it. All right, can everybody, I hope everybody can see my screen.
Looks good.
Does it look good? Great.
Yes.
All right, so I am here today to talk a little bit about involving patients and caregivers in research, engagement, and advisory action. And I am going to do the bulk of this presentation at the beginning, and then we are going to pull in Gwen and Rebecca a little bit towards the end. So I was about to say next slide, but that's me. Before we start, I want to do a little bit of level setting. I know that I come from a research background, specifically community-based participatory research, which is involving communities in the research process. I've also done work in engaging patients and caregivers in care and policy. And so I understand that sometimes the words we use, not everybody else understands. So the first couple slides are really just level setting. And I want everybody to understand what I'm talking about and we're talking about when we say health services research. So up on your screen is a definition of health services research. And truly, this is about how people get health care, about its cost, and what happens to patients as a result of the care. So the research that we're talking about here is not, drug development. It's not, psychosocial research. It truly is kind of how, what happens within the healthcare ecosystem. And when I say ecosystem, that could be in the doctor's office. It can be, at home when you are living with an illness or condition and trying to manage it. It can also be, around access and affordability of medication. So health services research is really a broad term, but it's focused on that kind of applied getting care, living with a disease or condition, and then how to, organize, manage, finance, and deliver high quality care. And you'll also hear me talk a lot about patient-engaged research or people-centered research, people-engaged research. There's a lot of terms for it. Patient-centered outcomes research is one that's really gaining a lot of traction. Essentially, this is just focusing on the involvement of patients, caregivers, clinicians, and other, key stakeholders in the research process. So we're not talking about how do we get more patients into trials. So we're not talking about participation or recruitment, although patient-engaged research can help make those pieces of research more efficient. We're really talking about patients being partners in on a research project. So patients and caregivers serving as advisors, sitting on advisory boards, serving as patient caregiver co-investigators, helping researchers disseminate results to their respective communities. So this is really about patients and caregivers being involved in the research process. And these are spaces that traditionally patients and caregivers haven't been a part of. So that's just a little level setting around some of the words I'll use. And really the movement for PAF and MPAF to strengthen our research infrastructure and the types of research we're engaged in and how we're pulling patients and caregivers into that space. So I am going to show you just two videos. They're a minute long. These ladies are working in this patient-centered research space, and they can speak to the value of it and what it looks like a little better than I can. So I'm gonna let them do that. And be patient while I share a different screen now. All right.
What excites me about this field is that it's a field now. It wasn't a field when I started out in research. The whole idea of focusing on the needs and wants of patients and communities is exciting to me because it means that we've had to reorient our entire research enterprise to have that kind of focus. And it means that rather than sort of doing business as usual, we can innovate in the ways that we're engaging, in the ways that we're thinking about research processes, and the ways that we're thinking about the design of research to meet this new field. We can't expect the same ways that we were doing research before to be able to meet the needs of the kind of research that we need to do now. So as a scientist, it's incredibly exciting to me to start thinking about innovative ways that have the same rigor, but innovative ways that allow us to meet the patients and families and community stakeholders where they are, so we can answer the questions that are most important to them.
And here's video 2.
Patients and their caregivers are asking a variety of questions when it comes to their care and the kinds of things that they can be doing. I think from the family caregiver perspective, you mostly hear about where they can identify resources that help them with the problems that they have or the issues that they're running into. How can they get more information? Who can they turn to? What's the best source of information for them? And the kinds of resources that they might need to solve a problem that they have. So anything that we could do in comparative effectiveness research or patient-centered outcomes research that could address those issues could be vitally important to them, especially when you find out from a patient-centered outcomes research perspective, when you find out what are the things that are most important to them, what are the things that are bothering them most, what are the things that they feel that they need. Those are the kinds of very specific questions that patient-centered outcomes research is all about.
All right, I am going to pause there and see if there are any questions, clarifying questions that anybody has about this little bit of information about patient-centered research or health services research that you haven't until I move on. I can't see faces, so I don't, I can't, I don't know if people have questions. So I just want to pause and see if you do. I'm going to give you just a couple minutes to put them in the chat. And if you don't have any questions, give me a thumbs up. I told you I'm an engagement person. I'm going to make everybody participate today. All right, I'm seeing a few thumbs up. All right, so this resonates for many of you, probably nothing new. And I'm going to keep going. So this really is why we're investing more in this research space. So couple reasons. PAF serves a number of patients, thousands of patients every year. And through the course of that work, we make a lot of connections. We hear a lot of stories. We collect a lot of data about patient experiences. And most of that information and the patient connections we have are patients that have some sort of access or affordability issue. It's a very unique group of patients. And when I say unique, I don't mean that it's not common. I mean that it's a voice that is often not represented in research spaces. So we really think that there's an opportunity to ensure that patients and caregivers that are engaged in research are patients that look like our patients and really are our patients. People with a diversity of treatment backgrounds, financial backgrounds, challenges with access, region, race, ethnicity, gender. There's a lot when I think about, the diverse patients that I want to see represented in research. It's a lot of diversity in a lot of different areas. And there's often a challenge right now in the research spaces where a lot of the patients look the same. Either they, are a very similar racial or ethnic background. They have a very similar treatment experience. They have a very similar socioeconomic background, right? And we really serve such a diverse patient population. We want to make sure that that diversity is represented in research spaces. So PAF does that direct patient support with programs. We also work in partnership and education, so trying to provide resources for patients and a number of other partners, clinicians, payers, industry. And then we also collect that data, which is that third bubble. And really what all that does together is it gives us a really robust So how PAF and MPAF works together is to take everything that we're learning by working with patients every day, day in and day out, working with healthcare systems, working with providers, working with payers, and taking that information and really helping MPAF supplement their policy and advocacy work with evidence. And so, when I think about research, it's that evidence, it's the million stories, right? One story is heartwarming. You can take 100 or 1,000 of those stories, and all of a sudden you have data, you have evidence. So really what we're trying to do is, expand our projects and partnerships. We want to ensure that any projects that we're focused on, whether it's policy or even when we're approached by partners to participate in research, is that those projects really focus on what is most important to patients and caregivers. And not only that they're focused on what's important to patients and caregivers, but they actually involve patients and caregivers, both their perspectives, but also involve them in the process. And that's the piece that we're really trying to build out. So just a little bit about PAF. I know a lot of you are here at Patient Congress because you have strong relationship with NPAF. Not as many people know about what PAF does. And again, we're the direct service arm. We're kind of sister organizations. And we also have been building a really robust research capacity. So We have our CEO, who is very interested and supportive. So it's important to have, leadership supportive of all these initiatives. My background is in patient engagement and research, policy, and care, but really focused in on research and then how you can take that evidence and inform patient-centered policy and patient-centered care. We have an epidemiologist on staff, Kate Gallagher. We have our EVP of Health Equity Initiatives and Community Engagement, Shanta Chambers. She does an amazing amount of work that you've heard through the past couple days, really focusing in on interventions and really being in and with communities. And then we also have a grants administrator and a team of data analysts. So a lot of information comes into PAF. We have to use that data of our patients to do reporting out to our funders and to people that are working with us in programming. But those data analysts can also help us with some of our research questions. And we also use them for quality improvement as well. So on the other side of the screen, you'll see some of our other kind of pieces that we think are part of the research puzzle. So we do have a patient and caregiver network, and I really want to focus in a little bit on that in the next couple slides. But just briefly, they are a group of patients and caregivers that have a history of access and affordability issues. They may not be struggling with those currently, but they have, at least in the past or currently have those challenges. They are a very diverse group, and we're always working on increasing our reach to even further diversify the conditions that we reach, the regions, race, ethnicity, age. I mean, we're really trying to make sure that we can reach everybody where the need is. And then we do right now have a very large group of conditions that we cover, so more than 500 diagnoses. And, at last count, we had about 10,000 patients that were active and willing to be part of this network. And we'll more about that in a second, but we do want to grow that. We also have a lot of providers that we work with. So we have a provider network, and these are not, for the most part, they're not the doctors. They are really the support staff. And that group of stakeholders provides a really interesting perspective into the lives and care of patients. We have a group of social needs navigators, both in-house and groups that we've partnered with. So this can really help us understand how financial and social needs navigation impacts patients. And then we have a number of academic partnerships. So for example, we have a project with UAB where they're using our case management services as an intervention to see what is the impact of having a case manager, a financial navigator, work with a breast cancer patient. And, does that have a positive impact on their outcomes? And, ideally, is that something that is going to be, fundable, which you heard a little bit about yesterday as well. In the blue, we really want to pull the MPAF policy team and volunteers more into this work, really as advisors, as thought leaders, as active participants, because this is such an engaged and unique group of patients and caregivers that we want to kind of marry those patient caregiver networks and pull in some of the interested MPAF team members and volunteers. So it's a little bit about what's happening at PAF, and there is a lot going on. And really focusing in on this patient and caregiver network. So when I arrived at PAF, I can't believe it's been almost 2 years now. We had a lot of patients that had signed up and wanted to learn more or be part of surveys. So they, kind of checked a box and said, yes, we want you to contact us if you have any additional, needs, if you have a survey you need us to complete, really just wanted to stay engaged with the organization. How we've used them in the past and how we're using them currently, although we're trying to change, really it's been kind of a 2 times a year survey, and those surveys were via email. The surveys were moderate to lengthy, I guess that's subjective, but 20 to 30 questions asking about patient experience around cost of care, affordability, transportation, barriers, goals of care. There's been a lot of different topics that we've covered. a lot of that work had been to improve PAF services. And then we also kind of took some of that information and we tried to map it to questions that NPAF had that could support the policy work. So really, hasn't really been a patient and caregiver network as much as it has been an email list, right? And so coming from the engagement and research space, I really saw this as an opportunity. We have patients and caregivers that have rich stories, a history of affordability and access issues that can help us, find solutions and help inform some of the policies and the interventions and the research that's going on. So why not pull them in a little bit, more meaningfully? So instead of just an email list where we're asking them to complete a survey once or twice a year, let's really build a network. And so that is exactly what we're trying to do. We're in the early process of it. So here's our future vision, and this really is a bi-directional active network. And so, one of our first steps is to what I would call, clean the network. Basically take the 10,000, 15,000 emails and really look at who has responded to surveys in the past, maybe sending out a message to see if they still want to be, active and a part of some of these initiatives, to make sure that when we have our defined group, it's those people that really identify that they want to be engaged or have been engaged in the past. We are currently, doing outreach via email. I think that's a pretty good way to do it. But, ideally, I think we are going to expand that outreach maybe to include text, and then, to have opportunities for real-time activities. And, real-time right now is what we're doing. Is Zoom, is phone calls, virtual sessions, but eventually we'll get back to in-person, and there will be opportunities to do, advisory committees for a project. Come to things like Patient Congress and share your voice. So really, we want it to be more bi-directional. While we're just not sending out emails and getting surveys, we're actually engaging this group with opportunities. So I think that, really another piece that we want to evolve this patient and caregiver network to be is to really focus in on what's important to patients and caregivers. So potentially that could mean starting to understand how patients and caregivers prioritize some of the challenges they're dealing with, or how they would prioritize research topics. Sending out messages maybe focused just on a particular condition or maybe a particular topic of interest. So for example, maybe, about 2,000 of our network members have identified transportation as an issue, and we can reach out and really dig in a number of different ways to understand transportation as a challenge. So our vision really is to take what was an email list and turn it into a very robust network where we are sharing opportunities, sharing information, disseminating back what the results of our surveys are, sharing, materials and resources, but then also really hearing from patients and caregivers and letting them identify what's important to them, what they want this network to be about, and how they want to participate. So that's our vision. That's our I think a realistic but ambitious vision, especially given the number of patients that we currently have. And so, really, how do we do that? Over the next 6 months to a year, we're really going to focus on understanding the type of messages that are most relevant to network members. We know that we're going to be competing with people for their attention. We know how easy it is to ignore an email message, to have something else be more important, whether that's an email from your daughter or an email from Amazon that something's arriving, right? We get millions of them. So we want to make sure that if somebody is taking their time to click on our message, to open our message, we are giving them something that is relevant to them in their life, whether that is a survey that covers things that they think is important and really including their voice into an important conversation or research topic, or resources. So we're going to figure out what those are and how those are different for different pieces of our community. We also really want to dig into the perception of research, right? When we say research, when I say research, I think of a particular, something comes up in my mind, right? That's different than every one of you. When I say the word research, I'm sure you think of something very different. Sometimes it's positive, sometimes it's negative, sometimes it's scary. And so we really want to dig into our members, our network members' understanding of research, what they think about, do they value it, and how our network members can navigate participating in research as partners, but also as participants. I think, I would never sit up here and say all research is good, even though I am a researcher and I'm a trained researcher. I think the best thing to do is to help people navigate research spaces, make sure they understand the language and understand how to decide for themselves what they want to participate in and why. And for our purposes, I think a lot of that really is going to be giving network members an opportunity to participate on the front end of research. That really helps you understand, as Rebecca Kirsch would say, the sausage making, right? Like how does this work? Because a lot of times, most of us, we don't know that insider information. We don't know what happens behind, the magic curtain. We just know when we get an email, it says, hey, will you participate? And then we also really want to know the priorities of the network. So we want to know from you, the patients and caregivers, what is important to you? What should health service researchers be focused on? And we can also help connect to those researchers that are doing that work. And if nobody's doing the work, we can promote that work and research needs to be done. So really understanding what's the most important from the perspective of patients and caregivers in terms of research that needs to be done, but also policies that need to be stood up, and then we can help get the evidence for those policies. So once we figured all that out, we will create messages and content that readies patients and caregivers to engage in research projects. We're going to collect those priorities and inform research and other programs. We're going to find opportunities and connect patients with them. So patients and caregivers are partners in this patient engaged research. And then really important, we're going to share back the results of everything that we're doing. So if you take a survey, we really want to make sure those results are back to you. If patients that, if one of our patients or caregivers is on an advisory committee around some research that's being done, we really want to share that information back. So not only do you understand the pieces that you've been involved in, but kind of what the network as a whole is doing. And I've been talking about you a lot. And so really some of this work has already started to happen. We have pulled in NPAF volunteers. I'm going to pause and let Gwen Darien share a little bit about a project that she was involved in that included some of our NPAF volunteers, the research project. And then I'm going to let Rebecca Kirsch chime in a little bit about her vision for future involvement. So I'm going to stop. Should I stop sharing my screen, Gwen?
I think you can leave it up if
okay.
You can see me. I think you can see, I can see me. I don't know if anybody else can see me. But thank you, Rebecca. And that was a great overview of some of the things that we've been doing. I think that many of our NPAF advocates have been aware for the last few years since Rebecca and I joined the NPAF team about the expanding opportunities that we've been trying to create for our volunteer advocates to be part of different projects that we're doing, whether it is being on Policy Consortium or doing a webinar. Susan Brown did a webinar with Yusuf Zafar on financial toxicity. Our first cost of care work, Tammy Taylor was on the policy consortium panel and brought one of her patients with her. And that actually inspired us to do even more work around cost of care and inspired us to do a workshop, a community workshop in the Mississippi Delta on cost of care. So the project that Rebecca Angove is talking about is a project that we have been, it's actually been years, we've been doing some version of this for the years since I've been here, which has really come out of the pillars of NPF's work. This was funded by Robert Wood Johnson Foundation, and it was funded through a series of grants. And so the pillar that we really focused on was on skilled communication, and then cost of care and conversations around cost of care. So recently, this most recent year, we had a project that we did with Avalier Health, which is a healthcare consulting firm in Washington, D.C., and really excellent firm with experts in quality measure development, among many other things, and with our WJF, Robert Wood Johnson Foundation, to look at how you might measure cost of care conversations. And our role in this was to understand what made them meaningful from a patient and caregiver perspective, and how to really have them driven by patient and caregiver concerns. So to that end, we brought in many patients and caregiver voices in a number of different ways. So we did two focus groups, and I think about 8 of our advocates participated in that, and some of them are on the screen today. We did 2 different focus groups, and we used that, what we learned from those focus groups, to not just inform what we did with our community workshops, but then we did a series of videos with our advocates that dug a little deeper into what these different measurement concepts were. I mean, one of the things that we found, which was no surprise, is that the measurement concepts really don't resonate very well with patients or caregivers, because a conversation about cost of care is down the road from where many people, down the path from where many people are in their access to care. And the question was about access and affordability. That's the barrier. The conversation about cost of care was part of that larger barrier. But we will share all of that with everybody soon. We're about to relaunch that section of the website. Out of those focus groups and these videos that we did 2 community workshops, and we did virtual community workshops. And unfortunately, I mean, we were all set. We had our plane reservations, our hotel reservations. We were on our way to work with Tammy in person in the Mississippi Delta, and then the pandemic hit. So we actually pivoted. The pandemic word of the moment, pivot. I have never used that word so much as I have in the last 6 months. We pivoted and did a virtual community workshop in the Mississippi Delta, and then with Tammy Taylor, and then our friend and colleague Freddie White Johnson. And it was an extraordinary workshop. I don't know, Tammy, you may have something you want to share on this, but I learned so much. I found the conversation was so rich, and it helped us think about not just what we learned, but what those next action steps were. And then we did a workshop on the south side of Chicago with our friends and colleagues at the University of Illinois Cancer Center, Kareem Watson, Vita Henderson, and then 4 patient advocacy groups, the Blue Hat Foundation, oh my God, I'm gonna forget all of the groups. Jamie's looking at me. I'm like, Jamie, what are they? Peer Plus Network, the group that works with UICC, and then we did a workshop there, and we consolidated that information and used that, and that information was then used to help put together a practice brief that Avalier has just finished. about how to do conversations on cost of care. And that'll really be the basis for the measurements that they will be developing. It's also for us the basis of a lot of work that we'd like to do in the future. So everything that we learn, nothing that we learn just has one step after it. Everything that we learn has multiple steps and multiple paths that we can take. And I look forward to sharing everything with you when we. I look forward to sharing. Chris wrote an incredible blog. We have our findings from the research. We have videos, and so we're in the process of putting those together. Jamie and I are working, and Chris are working on that, putting that together and putting that on our website and sharing it with you in different media. And Melissa just messaged me privately to say that Tammy's going to share more details at the next session. But I think one of the things that I've learned so much from Tammy, and I hope that Tammy has also seen that there's a connection between everything that we have been doing. We brought her in for our cost of care conversations, and then we did this community workshop, and now our next policy consortium is really focusing on rural health. And that was one of the things that was inspired by the work and our conversations with Tammy and some others. So thank you. I could go on for a lot longer about this, but I will. I'll turn it back to Rebecca to turn it back to Rebecca.
Thank you. Yeah, there's a lot of amazing things going on, and really people are at the heart of it. So thank you, Gwen, for sharing. Rebecca, I'm just gonna turn it over to you briefly to share a little bit about the vision for future MPAF kind of volunteer and integration of this research work with MPAF.
Thanks, Rebecca. And Gwen said exactly what our intention is for the future as well, and that's building off the learnings we've had from you previously. So the total cost of care workshops and the learnings there informed the policy development for our new financial toxicity project. So we build off what you tell us that's important. And I think in terms of the future, what
Rebecca, you froze.
There's a glitch in Rebecca's matrix.
Yeah. She'll be back in a second, I'm sure.
With patients and caregivers.
Hey, Rebecca, can you just repeat that? We lost you for a second.
For the future, our hope is it better sound now?
Yep.
Good. I have two virtual learners who may be in class too, so they're sucking my internet. For the future, our hope is to use what you all know about the patient experience, the caregiver needs, and help educate researchers about what matters. And I think there's ample receptivity from researchers, just as Rebecca described, to learn more, but we have to help them learn how to learn from patients and learn to speak our language rather than us having to learn this language of research. We have to help flip it around. Gwen often talks so beautifully about how trust is a two-way street. So too is the opportunity for using patient and caregiver voices. Not that we have to rise up and medicalize, but instead to pull them into what the lived experience is for patients and families. And there is no better force of advocates than all of you and the group that Rebecca has already involved in surveys to take it to that next level and help really manage up to academia. How do we better work in partnership to make research more meaningful, more effective? And that we can also be a key dissemination force for sharing the results of that research that they otherwise wouldn't have. So I think that's in particular, Rebecca, what I wanted to highlight before we go to the breakouts.
Yeah, and I'm so glad you mentioned that because what really prompted this was not just that we have lots of patients and lots of interest. Truly what prompted this was that we are we're getting more and more requests to participate in these research spaces. And so instead of just having one or two staff members or one or two, patients or caregivers that we're bringing, we thought, let's really model how to do patient engaged research and really, bring our entire group, or as many as we can with us, into these spaces, because for as great as, for example, you, Rebecca, or Gwen would be, sitting on a research team, wouldn't it be better if we could have an army that could help bring these researchers to what true patient-centered research looks like, not just tokenistic involvement of a gatekeeper, right? Which is how I feel I am, right? I can be a bridge, I can be a gatekeeper, but I don't want to speak for patients. I want to bring a group of patients to speak about their experiences. So I'm so glad you brought that up, and we have a lot of interest. So we thought let's build this the right way.
All right. So I believe we'll be going to the breakouts momentarily. I know, Rebecca, you're sharing your slide, and you're on mute if you want to add anything additional.
Yeah, so before we go to breakouts, so don't get too excited. Give me 2 more minutes. So I want to try something that I actually participated in a similar approach to breakout sessions earlier this week in a different conference. And I really loved it. I'm somebody who thinks a lot, can be a little quiet, and then it's really hard for me to jump in when other people are talking because I'm from the South, I'm too polite. So what we're going to do today is, in addition to having really great conversations in your breakouts, I actually created a Google document for each of the breakout sessions. I'm looking at it as the graffiti wall, right? So I want you to, once you get into your breakout session, your moderator is going to provide a link in the chat, and that is going to take you to a Google document that you can edit, open up on your screen and edit. You can use this space to type ideas so you don't forget them before you have an opportunity to discuss them. You can use this space to, jot a more lengthy idea or respond to something that somebody's saying. I don't necessarily want this to be an instead of, like, this is not to compete with conversation or to use instead of a conversation. This is really just to help that conversation and make sure everybody has an opportunity and a space to share their thoughts. So for this breakout, you guys are going to be focusing on 2 questions. What are the barriers to patients and caregivers participating in this type of patient caregiver network? So this patient engaged network that we want to build. And then the second is, I am so tired of calling this our patient caregiver network. We need a name. So what resonates with you? What would you want to be a part of? Any ideas for names or even pieces of names, we would really appreciate, because it's kind of a boring generic thing I keep calling it, and I'd like something else. So you are going to be automatically put in a breakout with a moderator, and they will take it from there. We're going to reconvene in about 10 minutes. So we'll come back at about 1:57.
We might have time for a couple of questions and answers from the group, and then we'll take a break before our next session starts at 2:15. So Rebecca and Gwen, I'll turn it over to you if folks have questions. And I'm looking in the chat box to see if any have come up. But of course, we can all see your faces. So if anyone has a question, please raise your hand or just unmute yourself and chime in.
And I put up my contact information in case anybody wants to reach me afterwards. And the Google Docs will also stay active. So you can always get back onto that link and add anything if you think of any thoughts, ideas later.
Yes, and I noted in the breakout room that I was on that I will also share the links at the end of the day, so you all get them via email too.
I will admit that I took notes on paper because I couldn't see the screen if I opened the Google Doc. This is Rebecca Kay, so I'll fill out the Google Doc after from our breakout.
There.
And I broke the rules in our breakout. I asked everybody to talk about a barrier, but also a solution. because I thought that we needed some solution talk.
Great.
We have some great solutions.
All right, I'm just scanning the room. Any last questions from anyone? Okay. All right, so it's 2:07. We have a little bit less than 10 minutes for break. Please, everyone, stay tuned for our next session starting at 2:15. This one will be focused on community advocacy engagement opportunities. And we'll see you back in a few minutes. Thank you, everyone, so much for your time. Take care.
Thank you so much for Nicole, everyone that's helped make Patient Congress what it is these past couple of days. I did want to just acknowledge our sponsors for their generous support to make this possible. I failed to do that at the beginning, but we really appreciate their support. This session here will just close out Patient Congress. It's focused on mobilizing communities, advocacy, engagement opportunities, and action that you can take with NPAF. And I just wanted to just mention that this is my my 7th Patient Congress. I think many of you know that I was a volunteer before joining NPAF staff, and 7 years ago was my first Patient Congress, and it was back when it was being held at the Washington Court Hotel in the middle of summer, and it was the very first person I met at that Patient Congress was Donna Gwynn. She and I just happened to go outside to actually get some hot air because the rooms were cold. And I remember being incredibly nervous about, being there, about the upcoming Hill visit. I had never, had done a Hill meeting before. And she was just like, "Oh, you'll be fine. You'll be great." And for those who don't know, Donna Gwynn was our director of grassroots advocacy, who passed away earlier this year. And I've been hearing from so many people about just how much of a coach she was to you as patient advocates, as you as volunteers. And that's what she was for me at that time too. She was just like, she had told me that I would really enjoy being a part of National Patient Advocate Foundation because she could just tell that I shared the passion about wanting to improve our healthcare system, wanting to improve the health experience for patients and caregivers. And she was just like, "You're around people who share that same passion, you're gonna love it." And she was right. I found my community. And I'm really excited to be in this role now as the Associate Director of Policy and Field Advocacy, and to continue the work that Donna started to build this infrastructure for NPAF. I've been telling many people, many of the new volunteers that I've spoken to, that our volunteer network, I think, and I may be biased, is one of NPAF's greatest assets. And, I think this session today is going to be focused on just what you all can do, and we'll also give you all an opportunity to hear from other volunteers about what they're doing in their community. And lastly, I will turn it over to Jamie Trotter, who's going to show you some really cool things that she's been building and will be rolling out early next year. So I know that there are a number of people here who may be new to NPAF, and so I wanted to take the time to explain what you all can do as volunteers for our organization. First of all, you can educate your community. We ask that our volunteers be ambassadors for us, represent NPAF, and we know that people have gone out in their communities and have held information sessions to promote Patient Advocate Foundation services and the work that we do at NPAF. Gwen had talked about this in the previous session, but we've done many of this previously, pre-pandemic. We've partnered with you as volunteers to hold educational workshops focused on insurance access, communication skills training. I think some of you have been a part of Can We Talk? The photo that you see there is our Can We Talk workshop that we did in Richmond last year. And I think there might be some opportunities in the coming year or years to do educational workshops focused on financial toxicity. And one other thing that we ask our volunteers to do is to help recruit others to our cause, others who are passionate about our mission. You know, it's, I think, a silver lining to the pandemic right now is that we've seen so many people wanting to volunteer with our organization, which I think is just amazing. And the reason for it is because they see and they've experienced themselves the shortcomings of our healthcare system, and they want to give back. They want to help improve it. And I personally love that. And we want those people to be a part of our network. So, you know, we think you all as our volunteers can help us, build that larger chorus. Another thing you can do as our volunteers is to join our grassroots campaign. If you participated in our session yesterday, we talked about our Get Covered campaign, which is what we're kicking off next week. I've already been getting emails about saying that they've registered for the sessions or for the kickoff call with Rusty Shelton. So we're incredibly excited about that. And we have some wonderful resources and tools for you all that you all can use to just disseminate on social media, to direct people to to just the importance of getting covered, and to the resources that will help them make the decisions about what coverage plan is best for them. And so we're really excited to kick that off next week. And it's actually our longest campaign, right, Nicole? We're kicking it off next week, and it goes all the way to December 17th. So we've put in a lot of work, and we hope you guys are just as excited about it as we are. And as I mentioned yesterday, the timing for this campaign just couldn't be more important. And I know a lot of you are also excited. So we hope that that energy continues in the next coming months. Another campaign that we've developed this year was our Be a Hero, Make a Plan campaign. And this campaign was something that we had thought of because of what we were seeing with the pandemic. We wanted to focus on raising awareness about the importance of care planning, to make people aware that, if you were to go to the hospital today, that experience would be very different compared to what it was previously. And so we wanted to make sure that you all had the tough conversations, had a plan, had a backup person. And so we've developed some resources. We connected with Dr. Tony Bach out of Seattle, who leads Vital Talk, and helped create some, videos and, tip sheets to help you all create the care plans. And this is something that we, want to continue to do in the coming years as as part of this calendar of campaigns that we're beginning to build. So I think you all are starting to get to the rhythm that, we have Get Covered coming up in the fall. And I think Be a Hero, Make a Plan is something we'll look forward to in the spring. But with that, we had talked about some other, ideas yesterday around, financial toxicity, this new area of policy development. And so you can imagine that, yes, we will be developing a campaign around that as well. And so we will just, I don't want to share too much, but other than that, we will definitely keep you all involved in that process. We're going to practice what we preach, involve you all in helping to make that a campaign. And I think we'll be doing one other campaign too in support of caregivers. I think the campaign line that we've been floating around internally is Caregivers Count, and I just love that. So those are just some things, some campaigns I wanted to share with you all. And in the hopes that you all will get excited about them, because I think these are just very concrete things that you all can do as our volunteers. Another thing I have listed here is what you all can do is engage policymakers. And I have policy in quotes because this isn't just engaging your legislators, but I think it's anyone who's involved in developing policy. So that can be your researchers, academia, and that's, calling back to Rebecca Angove's presentation just before this. Health systems, hospitals, other regulators, decision makers, anyone really who has a role in making decisions about how healthcare is delivered, we want to engage them. And also reflecting back to that past, to the previous session, we want to insist that patients have a seat at that table. And so this is, an example of some of what you all can do as volunteers. I have a photo here from the teacup meeting that Sabrina and Faye Hollowell were a part of last year. And Rebecca talked about this yesterday, but having both Sabrina and Faye in that room really made, and this was a room that, also included physicians, other healthcare professionals, other policy wonks, and having the patient voices present just really made people stop in their tracks. And that's what we want to continue to do. The other photo that I have here is from the step therapy hearing that happened in Richmond a couple of years ago. And, again, that's, engaging policymakers and, trying to influence policy change that will be better for patients. And, I think this year that this year where the photo was taken, I don't think step therapy passed at that time, but it did eventually pass last year. And so, I think I just wanted to, reflect on that because, these are just wonderful examples of what our volunteers, what our volunteers can do as volunteers for our organization. And we touched on this a lot, this power of patient stories and using your voice. I think this is something that I wanted to, say is an important thing that you all can do as volunteers. Use your voice, share your story, your experience. I loved what Gwen had said earlier. I believe it was you, Gwen, where you had just mentioned that you all are your own experts and you deserve to be heard. So whether, it's in those advisory council rooms or, opportunities where you can actually just share your story one-on-one on a podcast or write a blog post about it. We think those are all just very valuable. And we want to, we want to collect those stories and we want you to also to help us collect those stories. So those are things that I just wanted to emphasize as what you all can do as volunteers in as for NPAF. And I want to, I had mentioned that we have some volunteers here who will be sharing their experiences. And so I'm going to turn it over to them and I'll be calling on you guys to do that. But I think the first person I want to start with was Jessica Jones. And unfortunately, she couldn't be with us today. She wrote to me saying that she had something come up at the last minute and sent her regrets, but she was amazing and she recorded a video of what she would say if she were a part of this meeting today. And, I just want to preface it by saying that Jessica Jones is from Indiana. She's a caregiver and a patient herself and has done a lot in the chronic pain advocacy space. And she has used social media, YouTube, as a way to talk about what she's been experiencing. And with that has really become this advocate within the pain community, even within her own, local community. And I want to show her video now of what she said, because I think it's just a great example of what our volunteers are doing.
Hello, everyone. Gandhi is quoted as saying, "It is health that is real wealth and not pieces of gold and silver. Thomas Fuller said, "Health is not valued until sickness comes." As a patient, a caregiver, and a health professional, I've truly learned how precious health is. And over the years, as I gained experience in managing of hospital, doctor bills, navigating the health system, and having knockout, drag out sessions with insurance companies, somewhere along the lines, I found myself at warning others what the cost of being sick meant. My advocacy has grew into assisting anyone who found themselves fighting an illness and needed a friend to stand beside them who has fought a similar battle. As a healthcare professional, I was lost in a broken system and knew there needed to be more guidance, and my advocacy seed began to grow. I started my advocacy by hosting my raw emotions of what I was going through on Facebook to friends that I really didn't want to hear me complain anymore. Before long, I started a YouTube channel where I decided to get intimate and share my truth of being a chronic pain patient since childhood and the journey I was on for an intrathecal pain pump implant. I often share Christine Meserodino's spoon theory and refer to my channel friends as spoonies, a term for chronic illness patients. I named my channel Health Tea Spoonie. Get it? I spill the tea not only as a chronic pain patient, but all sides of the healthcare system failing us as patients. I found a passion in advocating healthcare costs, the system, and it's something we must discuss so they know it needs changed. Talking on YouTube has become therapeutic for me to share my thoughts and stories, and I have found some great people who have outreached to me and shared their own stories. It begins to build a community. I became involved with NPAF early in 2019, and I had my first real NPAF advocate event in November 2019 when I hosted a Get Covered health fair in my small rural community. I outreached to local doctors, pharmacies, and clinics to gain traction for my little events. And unfortunately, the businesses had confirmed to be participating no-showed my events. To make me feel worse, I had one person show up that day. I felt so defeated when I shared with my NPAF group how I only had one person show up for assistance with her insurance. But then a wonderful NPAF leader let me know how impactful I was to that one person. I thought the day was a failure, but hindsight, I was able to spend one-on-one time with this one woman and help not only her, but we discussed her sister, her family, and I was able to help deeper than I could see at the time. It was a good first event. Recently, I was a guest on Snow Company's live Facebook event, I Am a Patient, where I discussed my chronic illness, my son's illness, and coping during the pandemic. Last month, I spoke with Ashley on NPAF's podcast, episode 3, The Domino Effect of One Person Making a Difference. These invitations came by starting my journey with sharing my story. Don't underestimate the power of your story. It has an advocacy to make changes and inspire others. This year, I know advocacy can be a little difficult. It's not just been a difficult year for our fellow advocates, spoonies, caregivers, etc., but just for people in general. Yes, even the healthy ones. Knowing that my small rural community was asking the questions on where they could find food to cover their medications for the month, cover their new virtual fees from their provider, and some just hungry from the loss of their jobs, I decided to set up a Gleaner's mobile truck to come to our community and hand out food. They were happy to come out and offer to drive-through service. We were able to help people fill their pantries and fridges and then afford the things they really needed to, such as medicine. Gleaners has still been coming to our community once a month and has agreed to continue to come until December. It has made a huge difference in the health community by adding food. Don't be afraid to do as much as you feel driven and inspired to do, and don't feel defeated if you have multiple days where your illness is a high gear or you're tired out from caregiving to your loved one and need a month off. Your place in making a path in advocacy will still be there for you to lead. To close, let me leave you with this. It's okay if your advocacy only impacts one. Your effect on them will continue to be impactful even if you don't see it happening. It really happens. Advocacy is to change what is into what should be. And we all know our journey with NPAF is on the road to big changes within healthcare. Thank you.
Wow.
She's so great. She had mentioned that she and Ashley connected a couple weeks ago to record the NPAF podcast. And if you haven't had a chance to listen to it, I highly recommend that you do. Jessica Jones, along with Becky Barnes, who some of you may know, are both featured on that podcast. And it's just, Ashley just has such a lovely discussion with them about their role as, you know, advocates in their community, what they've done for their families. And I think just, again, for me, I talked about all of those things that you all can do. And I thought, why not bring our volunteers and have them share exactly what it is that they've been doing. I think it's better to provide examples. So with that, I'd actually like to turn it over to Tony Salary, who's on the line with us to talk about some of the work that he's been doing out in California. Tony, you'll probably have to unmute your line.
Oh, not yet. Tony, I think it might have been double muted, but in the bottom left, there should be a mic. There you go.
You're good.
Okay, so yeah, thank you, Melissa. Thank you for the opportunity. So I left Washington last year after the Patient Congress. I was very energized and used it as just as a way of making sure I actually did something useful. And in November, it coincided with the last year's Get Covered campaign. And I spent a lot of time pounding the streets and the pavement and knocking on doors in San Francisco, in posting flyers in gyms, in hospitals, in nursing homes, in senior daycare center homes. And it was a very educational experience for me. I wouldn't say I felt it was very successful. And in fact, I would say one major learning point was that there really are better ways of doing it now than that old-fashioned way. And I know yesterday there was a great session about how to use social media, and I think that is the way forward. And I did have one very interesting and amusing experience. I was giving a talk in a senior daycare center in the Tenderloin area of San Francisco, which is a very poor neighborhood. And I think there was about 100 senior folks enjoying a very good lunch. It's a free lunch every Tuesday, I think. And I had the misfortune of trying to give a open enrollment talk after their lunch. Well, by the end of my 5-minute or 10-minute talk, there wasn't a single person awake in the room. So that was very very funny.
Always before the lunch, right?
Next time I'll do it before the lunch. From January onwards, I also, on a totally different level, I spent quite a lot of time trying to participate in the Healthy California for All Commission. This is a commission that was created and established by Governor Newsom with a view to overhauling and the whole system of healthcare in California. The outcome is far from certain, and it remains to be seen when anything actually comes of this commission. It has in one form or another been going on for more than 15 years, so don't hold our breath. But it's an opportunity for California to lead the way, and it would not be surprising, just as California has led the way in pollution and emission standards. Maybe California will find the solution to a better healthcare system in our country. I'm trying very hard to get NPAF, our voice heard. The commission is going into community engagement stage soon, and we're trying to get our voice heard and a seat at the table. That's the good news. The bad news is that unfortunately last week it was announced that the commission has been suspended until sometime next year because of the pandemic crisis and also the never-ending fires that are experienced. So I think too many people are distracted in Sacramento, but hopefully it will start again next year. On another level, I have spent roughly 9 months training to become a Medicare counselor for an organization called HICAP. In August, I qualified as a licensed Medicare counselor, and I'm now conducting one-on-one training sessions, something like, so far I've done 6 one-hour sessions, and our objective is to do 6 sessions a month. So that's been a very interesting experience because Medicare, oh boy, is it complicated. It is so unbelievably rule-filled. For those of you who experienced it in one capacity or another, you probably know what I'm talking about. I'm not really a very good detailed person, but so it's been a very good experience for me. And a lot of fun, actually, and you certainly come across some challenges with people's situations about Medicare. Amazing how many people sign up for Medicare too late and end up paying penalties for the rest of their coverage. And the other thing that I've been engaged in this year is as some of you probably know, NPAF has got a seat at the table of an organization called ISA. ISA stands for I ought to know this, but I still have to read it. The Institute for Clinical and Economic Review. In effect, it is an organization that evaluates the clinical and economic value of prescription drugs, medical tests, and it has 3 panels that sit, one in the East Coast, one in the Midwest, and one in the West Coast. Rebecca Kirch is now a panel member on the East Coast panel, Alan on the Midwest panel, and I'm on the West Coast panel. Since in the last 2 months, the panels have got going again. They were all shut down. They're normally in public settings with the public in attendance. They've all gone onto Zoom and they're getting going again. I was on the first one I participated in was a panel on cystic fibrosis treatments. And the final report has now been issued for that. And yesterday, I participated in a public meeting for ulcerative colitis and the various treatments involved in that. I think the next ones are what I think in the East Coast, I believe they're doing, their next 2 are on hemophilia and nephritis, and in the Midwest, high cholesterol and bladder cancer. These are very interesting committees, and I think it's great that NPAF is involved because we are probably the first time the patient voice has been formally heard on this organization. So that's very exciting. In between all of that, like everybody else, I've been experiencing the delights of lockdowns and social isolation and distancing, and I think it's been a very tough year for everybody. So hang on in there, folks. Hang on in there. That's it. Thank you.
Thank you, Tony. Thank you so much for talking about your past year and sharing that with us. And you've been busy and but also doing really great things. And you'll have to let us know how the work continues to go as a Medicare counselor. You'll probably be able to provide us some tips with Get Covered coming up. Let me put my slides back up 1 second here. While I'm doing that, I want to call on Tammy Taylor to talk about the work she's doing in Mississippi.
Can you hear me?
Yes, we can hear you.
Okay. Good afternoon, everyone. I am Tammy Taylor, and I practice as a cardiology nurse practitioner in the Mississippi Delta. I also am a caregiver. I'm a patient. I feel like I've been an advocate for my patients before I even joined NPAF. I've began volunteering with NPAF approximately 5 years ago. My reason for volunteering was because I felt isolated in my concerns and at times hopeless because of what I was witnessing firsthand in trying to provide comprehensive health care to the patients I served. How I learned about NPAF is I met Faye Hollowell at a PCORI event. And as I expressed my concerns about issues that was happening in my home state of Mississippi, she suggested I get involved with NPAF, and here I am. I attended my first patient congress in Washington, D.C. in 2015. It was a year or two later. And for the first time in my life, I witnessed an organization truly in action on the Hill. As the saying goes, NPAF did not just talk the talk, but they walked the walk. One of my favorite quotes by Gandhi is, "You must be the change you wish to see in the world." And that's one of the things I always strive to be. Of course, when I was on the Hill, I was very nervous and I didn't know what to expect, but I was connected with Big John Thompson from Louisiana, and he took me under his wings, and I'm grateful for that. I will admit there were times I got discouraged because I desperately needed to tap into resources to help my patients and the Mississippians with so many issues that Maya and Shanta both so eloquently shared with us on the first day of the event. Finally, at our last patient congress last year, shortly thereafter, Gwen Darren approached me or called me, I can't remember which one, and she said, "We have resources to come to Mississippi to put on a workshop." We were both so excited, and as well as the rest of the team, and we began the planning phase. Our event was scheduled on March the 14th, 2020 in the Mississippi Delta in a small town called Mount Bayou, Mississippi. And if you've never heard of Mount Bayou, I encourage you to read about its history. The event was called the Mississippi Delta, where the heart of healthcare matters. We were going to discuss healthcare costs and potential resources, shared decision-making in healthcare. We were also going to do patient story slam for our local residents, and they were going to be able to participate, which was awesome, because sometimes they're voiceless in so many ways. The objective was to bring together, patients, healthcare providers, researchers, community and policymakers to talk about the challenges that people in our community face assessing and paying for healthcare. The event was, of course, as Gwen said earlier, was canceled because by that time the pandemic hit. And I remember the exact day that I got the email from Gwen, it was March the 9th. But because NPAF group is so just forward thinking, it was not long before I heard from Gwen again. And that's when she and Chris and Jamie and I began planning for the cost of care community workshop. And we also partnered with Freddie White Johnson. And I think that event happened on May the 27th. So they didn't stop because we couldn't have the event in March. And finally, we're here and we're about to begin the open enrollment. And this is a big part of what I do every day as a clinician, because I'm in clinic every day. Even in the pandemic, we never stopped seeing patients. We didn't do telehealth, we didn't do telemedicine. We just decreased the number of patients that we were seeing, of course, wearing masks and all the other protective gear, keeping our distance, but still seeing patients. And I use my opportunity to tell my patients that it's open enrollment, whether it's Medicare, and to let them know, because oftentimes patients don't realize that they can look at their plan and change their plan. And so I use my voice in that way in telling them and reminding them and saying, okay, it's open enrollment, and a lot of time that prompts a conversation. And the patients always ask, well, what does that mean? I said, if you don't like your plan, this is the time you can actually change your plan. Also, I use this opportunity when Get Covered come to talk to a lot of patients that we have that do not have health insurance coverage and still need care. Because as you guys probably know, Mississippi is one of the 14 states that did not expand Medicaid. So we still have a lot of issues there. So I just use my time at work to connect with patients even more, to get them to connect with PAF. And I have did that in the past, and some patients did come back and were able to get resources, so it's been very helpful. I also, during this time of Medicare and Get Covered enrollment, I also try to utilize other resources. I know it's a little bit more challenging this time because of the pandemic, but what I'm going to be doing is I'm a part of 2 big organizations that I'm very much involved in, so I'm going to also share this information with them. I'm also going to take the opportunity to put up flyers in the beauty and barbershops. Some churches are still trying to hold services, so I will take this information there. So any way I can get the information out, and like Melissa said, educate, educate, educate. Because like I said, my goal is to be the change that I want to be in the world. So I'm just going to do everything I can that's within my power. And I'm so thankful and grateful to be a part of NPAF. It has been such a rewarding experience for me, and I just look forward to doing more. Thank you so much.
Thank you, Tammy. That was just so well said, and I just really admire everything that you've done in your community, for your patients, and I consider ourselves lucky that you can be a part of our network and be included in our larger chorus. I'd like to call on Maureen Ormo Stewart next to share what she's been doing in West Virginia. I believe you're joining by phone.
I'm going to try. Can you hear me okay?
Yes, we can hear you.
Okay, so I'm winning half the battle. Here, I'm trying to get my video to work. We'll see what happens. Hello, everybody. I have to tell you, the last couple days have really helped my soul and spirit. I think it's the most people I've seen at one time in quite a while, even though it was on screen. I live in a really insulated community in West Virginia, and we don't have regular access to the internet on a daily basis anyway. Even before all of the school kids were utilizing it for remote learning. So one of the challenges that we've had in my community
there, Mel?
I'm trying to be.
There you are. We can hear you and see
Okay,
you now.
well, see, I don't even have to talk about this then. I just proved my own point. Yeah, we don't have regular access to the internet on a daily, it's not guaranteed, we'll say that. So one of the problems that I saw happening here was that we have a large elderly community. I think West Virginia per capita has the highest population of residents 65 and older of any state. And one of the things I saw happening surrounding COVID was that people were insulated away from their families. A lot of people retire here, or their kids grow up here and then move away. So we have a lot of elderly folks here that are kind of on their own. And the one place people were gathering was down at the farmers market, because everybody had a bumper crop of cherry tomatoes this year. So everybody was there every week. And we decided to do a little impromptu Be a Hero, Make a Plan workshop just kind of empower people and get them thinking about what, the silver lining of COVID was that people started to have these discussions with their families about what kind of care they wanted. People who otherwise might not have done it, like my husband, he felt like he was too young to do that. So we had a really good turnout, and it was very laid back and community centered. We shared our wishes with each other, because up here it's not uncommon for your neighbor to have a key to your house, but not your kids. So we just really made it engaging for the community and encouraged people to appoint medical surrogates for them, and then start thinking about maybe taking it a step further and creating an advance directive. It's surprising how many people thought that they had to go to an attorney and pay a ton of money to get that done. So it was really a success as far as education goes. And a lot of the people here really liked that. So that was a win. And the other thing I've been doing is I wrapped up my chemo and cancer treatment in February. And so that allowed me a lot more time to engage with the Epilepsy Foundation of West Virginia. And they, in June, appointed me to the board. And I've had a really great opportunity because our state legislature hasn't been in session for several months. I've gotten to work with a couple of our delegates on Safe School. Many of you know, I have a daughter who's 10 who has a rare form of epilepsy called Jan's syndrome, and I had to take her out of school and her pre-COVID because we just don't have the resources for our kids available in rural communities, particularly kids who need rescue medications. So on that note, we're trying to write a legislative mandate that would require nursing staff or trained ancillary staff be available for kiddos who need rescue medications, whether it's epilepsy, asthma, diabetes, that they would have a staff member available all the time to them who is trained in using their particular rescue medication. So because of COVID, I've had a lot of time to work on that, and it's been really fun learning how to write legislation. It's a good skill. It's a good skill to have, and I've, again, have had a lot of time that I wouldn't have necessarily had with people who are willing to help and have time to help, and they wouldn't typically have time. The other thing I've been working on is Melissa and Rebecca have invited me to workshop with the National Academies of Science, Engineering, and Medicine next month, centered around advanced care planning, which is something that is very near and dear to me. I faced a lot of hurdles with my dad when he was convalescing with cancer, again, in a rural community, but this time in California. And I'm really excited to share my perspective and my story with them, centered around advanced care planning and how we can make that better. And gosh, I guess that's it. I was really looking forward to seeing everybody this year, and Tony beat me in pool, so I was looking forward to the rematch, but maybe next year. Thank you again for the opportunity to talk. This has been wonderful this year.
Thank you, Mo. Thank you, Tammy, Tony, and Jessica. I know she couldn't be here, but thank you all so much for just sharing what you've been doing in your communities. Again, I think you guys provided just such great examples for new volunteers for just what they can be doing. So thank you all again. And I just I'll go over the slide quickly because I want to turn it over to my colleague Jamie, but I just want to mention some of the things that we offer our volunteers, our trainings. I think, you all had a taste of Patient Congress so far, and you can expect, skills and issues-based training throughout the year, focused on the work that we are doing, how you can be a part of that. As a volunteer, we have resources, toolkits that will provide to you, and you'll see an example of that next week with the release of our Get Covered toolkit. And we also provide a sense of community for you all. We do regular regional calls every quarter, so you all have a chance to connect with one another. And I wanted to mention, I had said earlier how I think our volunteer network is one of NPAF's greatest assets, and to really build this network to how we want it to be requires more than just me and who we have on our team. So I'm very excited to announce that we are bringing on a grassroots manager starting next week, Mary McKira. So I'm excited to introduce you all to her when she starts, and she couldn't be with us this afternoon, but she did participate in some of the sessions earlier this week, and I just wanted to provide something that we're looking for. I know I'm looking forward to for sure, and I think you all will just really enjoy her, and we hope to turn out a lot of these things that we talked about in a way that you all could be a part of it. So we're excited. Jamie, I'm going to turn it over to you now.
Thanks, Melissa. And thank you guys for sharing all of the amazing work that you've been doing throughout the year. This has been, so rewarding and exciting to see your faces, because this is my third patient congress. And some of you may remember I joined 2 years ago, and probably my first patient congress was about 2 weeks after I started. So I had no idea what was happening, but it's gotten better every year, and it's been the highlight of my year, getting to see all of your faces. And so this day, just to see you guys on camera, even though I can't physically touch you and be in your presence, has been really rewarding and enriching for me. So I'm going to be brief. We are short on time, but I want to talk about, as Melissa mentioned, we do have some trainings that are available to you and upcoming. And I think I need to share my screen, so please bear with me. I don't think I did that right. Okay. All right, is everyone seeing this? Okay, yep. Great. All right, so as Melissa mentioned, we do have some upcoming and exciting training for you guys. Since the pandemic has hit, we have seen an influx of new volunteers that are looking to get involved in our work, learn about what we're doing, how they can do it. And also for our seasoned volunteers, we want to provide some, in a sense, continuing education and some resources available to use to aid in the work that the amazing work that you guys are all doing in your community. And I know if you're like me, I'm excited for the new year, and I'm looking forward to 2021. So this is something to just add to your list, because it is forthcoming. Am I drawing? I don't know. Okay, let me not touch them out. All right, so we are launching a patient advocacy curriculum for our volunteers, and it's going to be rolled out in phases. The first phase we expect to roll out in January, just after the holidays. And the layout of the course for us, is going to be a pioneer. We recognize that there is a lot that goes in. Oh, I'm sorry. There's a lot that goes into the needs of accessing not just accessing healthcare, but talking about what matters to you, to your healthcare providers. And so we want to provide those resources and that messaging and those tools to enable you to do so. And so after much discussion, internal discussion, we've listened to a number of presentations from platform representatives and talked with our education team and our IT team. We have landed on a really exciting tool that will house the curriculum. It's called Talent LMS. Each volunteer will have their own unique access. They'll register for their own login, and it's going to be available through NPAF's website. And it's going to be mixed media. So you're going to have opportunities to hear from staff. You're going to have, we're going to have opportunities to hear from staff, opportunities to hear from field experts, around different topics. So we've, some of the modules you'll see here listed are an introduction to patient advocacy, what it means and what we mean by patient advocacy, some responsibilities and ethics in advocacy, core advocacy skills, health insurance literacy, health equity. We had some amazing talks earlier around equity. And so we're going to piggyback off of that. And effective communication and advocacy, how you use your voice and share your story and engage with media. This is a screenshot of what the learner will see once they log into Talent LMS. So they'll be assigned courses. Like I said, we're going to roll this out in phases. So as new courses become available, you'll get an alert that you've been assigned a new course. And when you log onto the system, this is what your view will look like. You'll have access to not only the modules that we roll out, but also an introduction and advanced features and tutorials on how to actually navigate Talent LMS. Okay. And then from the learner's homepage, you'll have the option to see what the course is about, who will be teaching it, what are the goals and objectives, and learn also a little bit about the people that will be your faculty. You're also going to be hearing from some volunteers, not just our staff, but volunteers. We have some great video interviews. We have some great, messaging and clips that we want to distribute to our volunteers, from our volunteers. And as they engage with us, we want to understand what, just like you've heard from volunteers today, what people are doing. So you're going to have the opportunity to hear from not just staff, but volunteers as well. And so for today, we have a few minutes. We're going to do some breakouts, but we want to learn sort of what matters to you, what needs do you guys have in an advocacy curriculum and training when it comes to promoting person-centered care in your communities. And so here are the questions for discussion during our breakouts. We want to know what matters to you, considering topics and trainings that you would like to be addressed. How much time do you think on average you'd be able to devote to this per week? We want to make sure that you're able to navigate through it in a reasonable amount of time and not take up too much of your time, but also make sure that all the information you need is provided. Have you used online learning management systems before? And if so, what were the pros and cons of those? What did you like, dislike? What deterred you from not using them? Do you have concerns about online training platforms? So those are the kinds of things we need to know as we get ready to roll this out. And if there's anything else you would like to add or think we should know as we get ready to build this, we want to hear from you. So just, Paul is going to assign you into breakouts again, and we'll have staff facilitators to just talk through some of these questions and provide feedback. And so thank you for your input. All right, I think everyone's returning back.
Yes.
Okay, good. And am I still sharing my screen?
You are not. You have to share again.
Not.
But, Jamie,
Okay.
also, we need to, yeah. And so we just started talking about all of this in principle, and I asked people if they would be, I think we have to now ask people if they'd be willing to do some user testing, because it's really good to take the in principle into what they're really good, what they're going to see.
Yeah, no, we had some really good suggestions in the breakout that I was with, and one that stood out to me was Julie Wallace shared that she would love live events. So, and that is one of the capabilities of Talent LMS, is to schedule a live recording, to have the option of people joining and engaging with the faculty and the other volunteers that are joining at the same time. And then there was another suggestion of having a forum. So I feel like the theme of today, that people really want to connect with each other. And so that's definitely something that we will build and be sure to include in the curriculum.
Yeah, and I think we had talked about that earlier. Jamie and I talked about this, the sort of blended learning environment, and would love to hear people's thoughts on that. Because you can do a lot of it in what they call asynchronous, where you go on your own speed, but you can also gather. And I've done some teaching in a blended learning environment, and it's great.
Yeah, so this, this session is just about coming to a close, but we did want to leave a few minutes for Q&A and comments. So if anyone has any thoughts on what Jamie and Gwen just raised now about this training curriculum, please feel free to share. Otherwise, questions are more than welcome. And then after that, we will close us out. I'll just pause for folks to chime in. And you can use the chat feature as well, and I can read out your question if you don't want to just ask it yourself.
So I just want to say that we promise we're not going to make it the same as Tony's Medicare training, online training. The goal is to make it energizing. And Sheila just asked if we're looking for faculty and trainers. We are definitely developing the curriculum, and we're really interested in ideas and are very open to people's suggesting sessions that they'd like to do that are part of this curriculum. I think Jamie said earlier that. Sorry, Sheila, 1 second. But Jamie said earlier that we were going to share, and she put up the first module that was recorded, which was Chris's, other people's stories and other advocate stories, because we recorded many of them. But we definitely are very open and interested in hearing other things. Sheila, did you have something you wanted to?
Yes, on that note, I just am finishing up a book on patient engagement and advocacy.
Great.
And there's a chapter essentially that could be perfect as an add-on to what you're doing. So love to speak to someone about how I can add some value and some help.
Yeah. So Jamie is the project lead for this, and we will make sure that everybody has everybody's email. That everybody.
So I just put my email in the chat. Hopefully I sent it to everyone. Yes, I did. So please reach out to me because this is a ongoing project. And like I said, the phase 1 should be coming out just after the holiday and the new year in January. So it is moving full steam ahead.
Awesome. Any other questions, comments? Susan Brown noted here that she would like to test and later do the training because she enjoys mentoring. So thank you, Susan. That's exactly what we're looking for. All right. Anyone else? I'm just monitoring the chat box. Okay. Well, again, you know how to reach us if anything else comes up. So without further ado, I will just pass it back over to Melissa to close us out for the day.
All right. Thank you, Nicole. I just want to give a final plug for our Get Covered kickoff next week. Please save the date. I will send again the call-in information for the kickoff call. It's September 30th at 2 p.m. Eastern. The slide includes the homework that you need to do beforehand leading off to the kickoff, which is really just to follow us on social media, research your local media, begin engaging your community, having those conversations about health insurance. And I think a lot of you are already doing that. So keep it up. And we'll look forward to hearing you on our call on Wednesday. To close this out, let me see here, my slides. I just wanted to share this this painting or drawings, an artist called Charlie Mackesy. He's British, and I shared his book with Rebecca because it has been something that has been giving me some solace these past couple of months. And if you haven't heard of Charlie Mackesy, he just does these amazing drawings, and they're about they're usually of a boy, a mole, and the fox and the horse. This is the book. And he has wonderful sayings. And this I thought was just a really great way to close Patient Congress. If you can't read it, it says, what's the best thing you've learned about storms? Asks the horse. That they make us kinder, said the boy, and that they end. And so I wanted to leave with that because I think if 2020 has been anything, I think it's been quite a storm of a year. And I think hearing all of what you guys, the volunteers have shared earlier today about what you are doing in your communities and just even the individual conversations and emails I've exchanged with many of you, in many ways, I see the kindness and I see the light at the end of the tunnel, and that gives me hope. And I'm, like Jamie said, I'm also looking forward to 2021 because I think, there will be a lot of good mission mischief, as Rebecca likes to say, that happens that year. I just want to give a huge thank you to NPAF and PAF, the teams that made Patient Congress possible. Normally when we're all together in the room, we have Sean Nason, Becky Whitehurst. You probably didn't see them, but they were working behind the scenes. Katie Donovan helped build our Patient Congress website and helped get all the materials out to you guys. Ashley, Jamie, Nicole, along with the content that they helped develop, were just fabulous moderators. And of course, Gwen and Rebecca and Chris Wilson, all the sessions that were put together were just amazing. And I also wanted to say Shanta Chambers, I think she had to jump off, and Rebecca Angove's not here anymore, but it was just amazing to have them be a part of these sessions. Paul King, you probably haven't seen him, but he's the magician behind the scenes. You get your own bullet here, Paul, because you've been amazing to make all of this possible. So thank you so much. I really appreciate working with you. And of course, to all of the participants, especially you all who hung on to the very end. I'm just tickled that you guys are still here wanting to listen to what we have to say. So, just thank you so much. And, Gwen and Rebecca, I just thought I'd, turn it over to you if you guys wanted to say a few words just to close this out.
Yes. So I loved closing out the day with connecting and hearing from people and closing out this team. And there was a lot of little chatter on the chat about seeing each other and not seeing each other, but at least we have Zoom. So I'm hoping next year at least we have the wharf. It is great to see people on the screen, and it's great to hear what's happening in everybody's communities. This has been an exceptionally difficult year on so many levels. It's been a difficult year for NPAF team personally with the loss of Donna. It's been an incredible year with the pandemic and everything that's happened to it, and also the undermining and the questioning of public health as a value, which I think is so important that we as a framework really think about the fact that what we do is really to help instill that public health is a value and equitable access to everyone, for care as a value. I think it has been also, as we know, a heartbreaking year in terms of the surfacing of racism and structural racism. But what it's given us is the opportunity to actually be bold and to talk about things in a much more direct way than we used to talk about things. So people would say things like they wanted to address health equity and health disparities. Now they talk about eliminating health disparities. We used to use politer words, and now we're talking about structural determinants of health, not just some of the other ways and we're really acknowledging what's built into our system or not our system. So I think that it is, I'm sure like many of you, I vacillate between cautious optimism and more than a little dread. But but I think that if we can do anything and if we learn anything from what's going on right now, I think what we learn is to be bold, to be direct, and to take action. And to take action by asking other people what they think, what they feel, what their experiences are, which is really the hallmark of advocacy, and then take action on that and work together to create change. So thank you everyone for what you do. This was an amazing, this was a great 3 days, and I have to say I particularly love all the people stories, which is and I want to give a special thanks to Melissa. Melissa did an extraordinary job pulling this together. I think that, yes, I don't know if everybody realizes how much work Melissa put in. I'm sure you do, to pull this all together. She did a phenomenal job, and it is not easy to pivot from being in person, where you get that, where you really get the being in the same room together and sort of breathing as one, to this very sometimes alienating screen life. But thank you so much, Melissa. Fantastic job.
Thank you, Gwen. Rebecca, I want to make sure you had a chance to say some words too.
All I will add is that we are so grateful to the team, but to all of you who hung in there, as you said, Melissa, because this is our community. We needed it as much as you did. And even though it's in 2 dimensions instead of our usual force, we are all the stronger for it and all the kinder for it, to borrow from the beautiful ending that Melissa shared with us in the quote. So we can't wait for what's ahead, and we hope you have a beautiful restorative weekend. Thank you for your time, your commitment, and we're eager to see you for Get Covered.
Thank you, Rebecca. Thank you all. It was so wonderful to see you guys. Have a great weekend, and thank you again.
Thank you.
Bye, everyone.
Bye.
Bye.
Bye. Bye.